When I was growing up, my grandmother had dementia, and so I was in music school at the time, and I noticed that music was a way to connect with her in a way that sort of language wasn't anymore, and so that informed my decision to switch my career actually from music to medicine. We see anything from a memory complaint that's objective to mild cognitive impairment where it doesn't affect the activities of daily living to dementia where you have cognitive decline that leads to functional decline. Sometimes there's a split sort of between what the patient is noticing and what the care partner is noticing. And so I try to make sure that the patient feels seen and feels heard, and I see what their concerns are and then try to match them with what the care partner is seeing so that they can map out a care plan that works for them and their care partner. One of my goals is to make sure that when spouses come into clinic with me, they're able to leave and feel like they're husband and wife together or partners together rather than being stuck in that patient-caregiver relationship. That sort of puts that onus back on us as the care team, along with social work and our nursing staff. And all of that together allows them to feel supported so that they don't have to be cast into those roles. It helps the relationship. I think it's important to incorporate people that the patient trusts into their care team because that establishes the foundation for their life and their care planning long term. So there's not a one-size-fits-all. Making sure that we prioritize patients' values and make sure that we make decisions that are in line with their authentic self, with or without Alzheimer's disease or dementia is really what the goal is. With dementia, I think a common misconception is that the brain isn't working at all anymore. But I think it's just one specific part a lot of times in a memory disorder. And so we try to take the focus away from that part and allow accommodations and support so that patients can live the life that they want to live, happy, safe, healthy, focusing on their strengths rather than drawing attention to their weaknesses. It's sort of an intimate space to be able to be in the room, trying to support the patients and also their care partners through the journey. Allowing patients to feel seen and feel heard when their brain is changing in a way that they can't control is what really brings value to my day.